Hello, my name is James Church. I'm a colorectal surgeon at New York Presbyterian Columbia, and I'm going to talk to you today about anal fistula. Not the most glamorous of subjects, but an important one to patients that suffer from this condition. It's a common condition. It happens when you develop an infection around the anus and it drains out through the skin beside the anus, and the skin starts to discharge. So as a patient, you know, oh, I've got pain around my bottom, and the pain gets worse and worse, and then all of a sudden the pain will diminish and you'll notice a discharge of blood initially, and then pus. And then the blood and pus just keep coming. Sometimes the abscess doesn't drain by itself, and you go into the emergency room and they drain it for you. And again, you get blood and pus, and that continues. Sometimes the blood and pus will stop and the abscess will come back, and then it'll drain again. These will sometimes go on indefinitely until they're fixed, and fixing them is a real challenge for colorectal surgeons. Oftentimes there's a two-stage approach where we first put patients to sleep and then drain the infection in order to get it ready for repair. There are many different ways of repairing it, but the important thing is to choose the best repair that doesn't involve making you lose control of your bowels and has a very good chance of fixing it. Because if you fix it, then you're done for the rest of your life. You can get back to normal. You don't have to put up with these symptoms. Here at NYP Columbia, we have a good track record with these fistulas, and we know how to treat them. And with the cooperation between patient and doctor, we can take care of it for you. Thanks for listening.